So thank you very much for tuning into this video where we're going to describe a new research study that you may wish to get involved in. So the study is called LiSENUS, and it is a study where we're trying to design a brand new ultrasound system to find cancerous deposits in the lymph nodes of people with breast cancer. So who am I? So I'm actually a breast surgeon. So I work in Kent. So I'm based at Maidstone and Tunbridge Wells NHS Trusts. And this study has been designed together with my collaborator, who is Professor Mengjing Tang, who's a very clever biomedical engineer based at Imperial College London. So we've been working on this project for quite a long time. And you may ask, well, why do we need to do this? Why do we need a new ultrasound test to find these cancerous deposits? Well, that's because we don't have one, quite frankly. And at the moment, as a surgeon, we need to take out lymph nodes of anybody who's diagnosed with breast cancer to see if they contain cancerous deposits or not. Now, I know that statistically, only that 70% of people will not have cancerous deposits. So lots and lots of people are having surgery in their armpit for no real benefit. So that's really been the driver of this project. And it is a big collaborative effort, this. So it's not just us in Kent, and it's not just working with Professor Tang, but we've also got clinicians at Imperial College London Healthcare who are also on board. So we've got Professor Adrian Lim, who's a very respected radiologist, and Dan Leff, who's one of their surgeons, is on board. And as well as that, we have statisticians from Warwick University, and also a group called the London IVD Group, whose role is to just make sure that any test we design is going to be very usable, is going to be patient-friendly, and it's going to be cost-effective for NHS resources. The study is funded by the National Institute of Health Research, which is the main funder of NHS-based research in the UK. So what is this contrast that we're proposing? So the contrast is microbubbles. So what are these microbubbles? They're tiny bubbles. Each one is smaller than a red blood cell. They have a phospholipid membrane and they have hexafluoride gas inside. And what they do is they reflect the ultrasound beam. So they can be seen, they can be visualized on ultrasound. Microbubbles have been used for many, many years to look at blood flow in the heart, in the kidney, and in the liver. And over the last 10 years in Kent and other parts of the world and the other parts of the UK, we've been pioneering another use of microbubbles where we actually inject them into the breast so that you can gain access to the tissue fluid channels and follow them as they move up to the lymph nodes in the armpit. Now, we know that people have a sentinel lymph node. So a sentinel lymph node is the first lymph node to receive tissue fluid from the breast. And if this lymph node is free of cancerous cells, then it's very, very unlikely that the rest of the lymph nodes in the armpit will contain cancer. I'm delighted to be joined today by two of my colleagues. So my first colleague is Claire Marie, who's a research radiographer based at Maidstone, and she tends to be the person who meets you if you are getting involved with this research and pretty much looks after you and makes sure that the research is running well when the procedure is taking place. I also have Fran, who I'm delighted to say I've known for many years, and she's a very experienced research ambassador, and she's a patient who's had breast cancer in the past. So I'm going to speak to both of them and ask them a few questions, and they can tell you what to expect if you take part in this research. So Claire Marie, so tell me, as a patient, what could you expect as you come in for this procedure?
On the day of the procedure, you'll arrive into our department where I will greet you. You're then taken into a side room, and that's where we will take consent. So we'll give information, further information, answer any other questions or anything like that. I'll be in the room as well. What we do then is we have like a questionnaire where I'll then do your height, your weight, check a few bits to do with any medications, things like that. We then get you to take a seat. You will need to be cannulated. So that's just something that goes into the vein in the arm so that we can administer the microbubbles during the procedure. Once we've done that, what we do from there is we take you into the room, and that's where we'll do the LiSENUS trial. There's a doctor, there's a radiologist, we have Matthew, so he's from Imperial College, he's our engineer. And also I will be in the room as well during the procedure. So it takes roughly probably about 20 minutes or so, something like that. During the procedure, there is a lot of technical talk, I would say. So and quite a bit of medical terminology as well. So that would be between Matthew and the radiologist and the doctor maybe, because what they're trying to do is make sure they have the right contrast settings on the equipment and the machines. So that can feel a little bit daunting for the patient, but obviously I do pre-warn the patients, before they go into the room, because that can be something that can make you feel a bit nervous. But at any time the patient can stop, if they feel uncomfortable, they just have to say so. Yeah.
And so they get injections. So where do they get the injections?
So they'll have intradermal injection, and that will just be around the nipple area, and they also have the intravenous injection, which is why we cannulate the patient. So, and that's with the microbubbles. So.
And have you noticed anybody have any reactions or any issues with that at all?
No, nothing at all.
Okay.
Completely safe.
So that's good, isn't it?
Yeah, really good.
And how about biopsy? Will some patients need biopsy?
Yes, so some patients will need biopsy, but they will know that. So they will know on arrival anyway. So that would be similar to the biopsy they had before, but the difference will be biopsying the lymph node.
And is that the lymph node that they find with the microbubbles?
Yes, it will be. Yeah.
Okay. Yeah. And a biopsy safe in the armpit?
Absolutely. Yeah. So
there are maybe some potential small risks of bleeding, but they're very low, aren't they?
Yeah, so it is similar to if they've had a biopsy before in the breast, it will be similar to and the aftercare as well and things like that is similar to the same.
And because we've now done this procedure with quite a few patients, is there anything that people tend to talk to you about or worry about particularly?
I think where I keep emphasising the room, I think that's one of the things, because I think there's so many people in the room and it's quite an intimate, it's quite an intimate thing, isn't it, in a way? So that's the thing that they do mention, and that's why, every time I do go through that and say that there will be people talking in the room. Because whilst you're laying there having a scan and you've got people talking over you, that can
feel a bit vulnerable.
Maybe. Yeah, I think so. But if each patient knows and, they're pre-warned, then they're quite happy.
Yeah. That's lovely. Yeah. So thanks Claire Marie. I think that explains things really nicely.
Okay.
So I'm going to turn to Fran now. So Fran, as I said, is our research ambassador. Fran, tell us a little bit about your journey and how you've got involved with research.
Well, I worked for the NHS, and just prior to retirement from the NHS, I developed breast cancer, and I was one of the first patients to experience the first microbubbles.
Yeah.
And I felt comfortable and safe, I have to say, at that time. Unfortunately, I developed bowel cancer the next year, but I have to say, 10 years later, I'm here, I'm well, I'm clear. And I decided that upon retirement, I would have to give something back to research. I'd have to give something back. And that was when I decided to become a patient research ambassador. And the role is to raise awareness of research taking place within the trust, because people, when they walk in a hospital, do not realise what research takes place in the different specialties.
And you were our tester patient, weren't you, for the LiSENUS study? So
when the new LiSENUS study came about, I was a tester patient. And as Claire Marie said, it was a busy room.
Yeah.
But I felt comfortable, I felt safe, I felt secure. Everybody was friendly, everybody was clear and concise about what was happening, and I didn't feel uncomfortable, and so I was very happy to participate in this and to see this study going forward.
And as somebody who's been through breast cancer yourself, tell us a little bit why lymph nodes are so important.
Oh, they are so important. They really are. This advancement is going to be so good for patients in the future, because there's, as we'll say, unnecessary operation in the lymph nodes, and it will just help patients so much. Recovery will be better.
Yeah.
It'll be so much better.
Yeah. And you always have this lovely phrase that you tell me about why research is important, and it's really stuck with me.
Yeah. Today's research is tomorrow's treatment.
That's brilliant. So thanks, Fran. I think that's really useful. I think as a patient, you can see that, yes, it is a little bit daunting going into a room full of people, but I think research is the only way we can bring things forward, isn't it? Yeah.
Yes.
So thank you. So thanks very much to both Claire Marie and Fran for explaining what to expect if you take part in the research, and also the importance of research and why it is so crucial that we all get involved with this. I think Fran puts it best when she says that today's research is tomorrow's treatment. So thanks very much for your attention, and thanks so much for your interest.